Drink healthy.
Reduce sugar chubby with the same great taste. Lots of magic fruity flavors. Drink the more healthy way.
It tastes so yummy, chubby, chubby.
25% less sugar chubby. Be active, be healthy. Drink lots of chubby. Kicking football, playing cricket, having fun in the sun.
It's chubby.
Reduced sugar chubby keeps you cool and refreshed.
It tastes so yummy, chubby, chubby.
25% less sugar chubby. Jumping rope, running races, have fun.
It tastes so yummy, chubby.
Drink the more healthy way. Well, hi there. Very good morning to you. Time to welcome you now to another edition of Voices on WinFM 98.9. I'm your host for today's program. My name is Clive Bacchus, and I'm happy to have in my company as well Mr. Livingston Sargent's son. His name is Trent Sargent, former data capture of the West Indies Cricket Board and all that. He is doing the technical work today. And I have on the line Mr. Dr. Arthur Tim Garson Jr. I want to say a very good day to Dr. Garson. Dr. Garson, good day to you.
Good morning. Good morning to you, Clive.
Good to have you aboard. I will let my listeners know who I'm speaking to. Dr. Garson is an elected member of the National Academy of Medicine, Institute of Medicine, Professor, Management Policy and Community Health, University of Texas, UT Health, School of Public Health, and he's agreed to grant us an interview today on WinFM 90.9, for which we are very grateful. And we wanted to get a little conversation with you today about all things USA. Now, the USA, of course, has been looked up as the shining example on the hill, you know. So when we look at what has happened with COVID-19 in the U.S., some of us are startled. We're taken aback. We would have thought that the U.S. would have been showing everybody else how to deal with COVID-19 based on your expertise, your knowledge systems, and of course the fact that you are the preeminent nation in the world in terms of your statistics and all that. What happened with COVID-19 in the U.S. in your view, Dr. Garson?
So let's be sure, Clive, and I hope your listeners are willing to put up with it this way. This is me talking. This is not some institution talking. So let's just make sure that we don't think I'm talking on behalf of anybody. I think COVID-19 was a combination of really awful things that happened all at once. I know there's a lot of blame being pushed around, but if you go back and you say what happened, I don't think that the U.S. was terribly well prepared. That's pretty obvious. What may be a little less obvious, Clive, is that the U.S. is almost unlike any other country in the world, pretty much unlike, where we don't have any centralized health care at all. Okay, so St. Kitts and Nevis has centralized health care. You have people that can say, here's how health care is going to go for St. Kitts and Nevis. The UK, France, Japan, they've all got centralized systems where you can then say, okay, here's how we're going to prepare, here's what we're going to do. The U.S. doesn't have that. And so you have to then say, all right, we have a national problem. Imagine trying to fight a war, the Defense Department, if you had to do it at the level of every state. That would be stupid. But that's the way that the U.S. has had to handle this. We have had a national problem that the national government, not only there wasn't an infrastructure to deal with it, but that president decided he didn't want any part of it. And so you had two problems working really almost in tandem to make the whole thing worse. That's that's sort of the big picture. I'm happy to drill down some, but that's really, I think, the big picture of what's happened.
Well, for many years, people in the USA, well-educated, well-trained policymakers alike, predicted a pandemic in the USA. There was a pandemic policy left behind after the Obama years, as far as I can recall. There are predictions people point to now, those who are concerned about vaccines, the anti-vaxxers and all that, speak about predictions coming from prominent people in business, and they're concerned that, everybody saw this coming, so how would you not be prepared?
I think that the plan may have been there, and I think that no one enacted it for starters. So the plan may have been there, but in order to that was a national plan. In order to enact a national plan, the national government has then got to enlist the help of the states. And this particular national government had no desire to do anything, whether it was with the states or with the national government itself. So what you're seeing now with President-elect Biden is now how to mop that up and how to deal at least with a national policy for vaccine distribution. But again, the states are going to make the final decisions of how to do it and who gets it. I don't think that's necessarily, Texas is different from New York, is different from California. But I believe that, so the states are going to make the final decisions here, but at least there are going to be national guidelines. The Center for Disease Control and Prevention, the CDC, once the FDA approves the first vaccine, literally within 24 to 48 hours, the CDC is going to talk about countrywide recommendations, but then how those countrywide recommendations are enacted is going to happen at each state. And so that's how it's going to be. And that's, given the way that our government works, that's probably right, but you never saw that happen in the Trump years.
What about the issue of people who feel that to wear a mask, because you have to talk about what is called the science, hand sanitization, social distancing, physical distancing, the wearing of masks in public. You have a strong pushback apparently from significant segments of the population, people seeing the wearing of masks as a violation of their rights. How do you tackle that?
Well, I guess I might ask them if going through a red light is a violation of their rights. There are things that just make sense, Clive, and there is so much data to support not only the fact that if you wear a mask, you're protecting the people you're with, but it was just obvious to those of us that did public health. But finally, the data came out that you protect yourself. And so why on earth? It is the analogy, I think, is exactly right. Sure, you want to go through a red light? Go for it. Is it your right to go through a red light? Well, no, we have laws against that. We have strong suggestions to wear a mask. In some places now it's mandated, so it's law, or at least it's state policy. I understand that there are people who feel that way. I just happen to think they're dead wrong. And I say dead wrong, meaning that it puts them at risk of death, and it puts the people around them at risk of death. That there are a lot of things, I believe, that you could stand and say, okay, this is my right to do A, B, and C. I understand that. I'm all for individual rights. This is not one of them.
I asked the question because at the moment we're hearing about vaccines being 95%, 94%, 80% successful, and people are looking forward, of course, across the globe because of what COVID has done over the past 8 months, crippling economies, putting people out of work, and killing a lot of people and injuring some people for perhaps the rest of their lives, as far as we are aware. So people are thinking, well, okay, we need to have a vaccination. Now, if you're going to have the kind of pushback you're having with wearing of masks, do you anticipate the issue may be one as well with vaccines? Because it seems to be a trust issue here. People are saying we can't trust these people.
So I think that is added. First of all, I've actually written an op-ed on this topic, so I've certainly thought about it, and I wrote the op-ed at a time when I myself was very concerned. If you go back and look at what happened, President Trump nearly told the drug manufacturers to jump the gun and go ahead and distribute the vaccines before the safety data were available. If you go back and look at that, that was the origin of what happened, Clive. That was when people started really to get worried about the vaccines themselves, because the President Trump wanted to get the vaccines out at that time, even before the election, to prove that he was able to get the drug manufacturers to do that. Now, what happened is, very fortunately, the drug manufacturers themselves said, "Nuh-uh, we're not going to do that. We're just not going to release, or we're not even going to apply to the Food and Drug Administration, to the FDA, for approval until the 2 months for collection of safety data has passed." And that's what, I sort of made a little bit of an aside in my op-ed, that was at exactly the time that the president himself got sick. And he had, before he got sick, he had threatened to try to move along this process much too quickly. And then the process was approved literally when he was sick. And it's almost like, okay, people said, all right, we're going to get this process done where it's required to do 2 months of safety data. But I think the drug companies were even more responsible in that. The drug companies said, we're not going to do that. And so if you now look at the Pfizer data and at the Moderna data, where Pfizer has now applied, Moderna is about to, they have had 2 months of safety data. And so that's a big difference. Well, you'd say, is 2 months enough? Actually, the vast majority of the complications are in the first 2 weeks. When you see complications, that's when you see them. You don't see very many, hardly any after 2 months. Now, we don't have, let's understand this clearly, we don't have data of 5 years after somebody has been vaccinated to know what happens. We don't have those kind of data. That obviously takes 5 years. But I think the person to watch, the person to listen to, is Dr. Anthony Fauci. If Dr. Fauci says, go get a vaccination, I would go get a vaccination. He is, to me, a hero of this whole series of events. He's straightforward. He tells the truth. He's transparent. If Fauci says get a vaccination, I'd go get a vaccination. If Fauci says don't, I wouldn't. Now, I know he's been optimistic about the vaccinations. I've not, and I may be behind a week or so. I don't think so. I don't think he has come out and said, go get it, because I don't think they're approved yet. I mean, the date, I believe, is December 10th, when the approval date by the Food and Drug Administration, and then shortly after that, the CDC. So that's a long way of saying, as a guy I'm a pediatrician. I've taken care of patients for 30 years. I would have a vaccination that is approved by the FDA, that is approved by the CDC. Would do it, and I sure would listen for Dr. Fauci to say that before I do it. But I don't want to anticipate what another person is going to say. But I would believe that once those are approved in the middle of December, I'd go have one the next day.
Well, let me ask you this, Professor, before we talk some more about the vaccines. Let's talk a little bit more about COVID-19 in terms of what it does to people in different demographics, different groups, if you like. Tell us a bit more about COVID-19 in terms of the effects it had on people. Yes, we know we've had the deaths, of course, but we're hearing now about some illnesses that can persist for many a year. We're hearing sometimes there's not a full recovery. We're hearing as well that there may be mutations. We're hearing a lot of things. What can you tell us that we know now perhaps more about than we knew before?
Well, I think unfortunately, we're still pretty early, Clive. We're still, the things we know about COVID, the one that it's similar to is SARS, S-A-R-S, but SARS is much less lethal and much less communicable. You get less person-to-person transmission. And so when I say we're pretty early, we don't know what 5 years of COVID looks like. We really don't. So and I'm certain there will be very close follow-up studies done on people who have had it or people who have tested positive and had no symptoms, because that's a group of people that you'd say, well, are they safe, even though they tested positive but had no symptoms? To me, just think about this rationally. Symptoms to me may be different than symptoms to you. One of the symptoms that people talk about with COVID is a loss of taste and smell. Well, maybe I don't notice that, And so there are people that are said to be asymptomatic that may not be as asymptomatic as others might think. So that's not a thing that comes down and says, okay, you're symptomatic, you're not. And so even the fact that you are or are not is a little iffy. So I think we're in the middle. We're early. Obviously, we're early in a 5-year period to say what really happens to these people. I don't know the answer to that. What we know in the sort of short-ish medium term is this is a virus that goes all over the body. Every virus goes all over the body. That's nothing new with viruses. The problem here is this virus goes all over the body and in some places infects another part of the body, not just the lungs. And in fact, I'm a cardiologist. It affects the heart. It affects blood vessels to the heart. And so I think it's not just, when you affect blood vessels to the heart, that's just like a heart attack. But it does more than that, Clive. It actually affects the heart muscle. And so it weakens the heart muscle. It's called myocarditis when you actually get an infection of the heart itself. It does both of those. And so it burrows into arteries, the virus, and it can cause, when a virus burrows into an artery, the artery can get narrow, and it can then block the blood going to that organ. It happens in the heart. It happens in a number of places. It happens in the brain. And so there are things we know and things we don't know. I think it is much more dangerous than people think it is. I think the long-term effects, again, I do not necessarily believe that we know that if somebody's asymptomatic now and tested positive, that they will be perfect for the rest of their life. I hope so, but we just don't know that. So I think this really bears some watching and looking down the road at people.
You listen to WinFM 90.9. We're speaking to Dr. Arthur Tim Garson. Dr. Garson agreed to speak to us in WinFM 90.9 on Voices at the moment. He's an elected member, National Academy of Medicine, Institute of Medicine, Professor of Management Policy and Community Health, University of Texas. And he's made it very clear the views that he's offering on this program are his views and do not represent an institution. So the other question I have here lined up is I'm trying to wrap my mind around whether we have any sense of demographics you can share with us in terms of do we have the data yet in terms of women, men, children, and that sort of thing that you could help us to wrap our minds around?
Just hold on one sec. I'm sorry. Again, we may not even know what we don't know. We know that the virus is very communicable, and it's very communicable in closed spaces. Okay, so we know that, for example, a closed restaurant, I believe I saw the data that that the likelihood of getting the virus inside versus outside a restaurant may differ by as much as 19 times. So you don't want to eat inside a restaurant. You don't want to go inside a bar. And so the reason for that is people are breathing on each other. And, you know, if you think about bars, restaurants, the noise level itself is higher than being at home. And so people talk louder. If you talk louder, it is more likely to spread the virus beyond the 6 feet people talk about. And so we know that small, tight places, bars, restaurants, are important, plus the duration. So small, tight places, the duration seems to be 15 minutes. You know, if you're a bartender and you're in a bar for 4 hours, you're probably a lot more likely to, you know, whatever that number is, than somebody who comes in for a drink for 12 minutes. So duration, small place, we know that. We also know that people with underlying conditions are more likely to get the virus, or not just to get it, but get sick from it. So what kind of underlying conditions? The one that seems to be sort of the easiest to understand is if you've got underlying heart disease or lung disease. You got that, right? I mean, if you've got coronary heart disease, you've already got, blocked blood vessels to the heart. You put COVID on top of it, that's a potential real problem. If you're a smoker and you have chronic lung disease, you're going to get more likely COVID on top of that. And so those are easier to understand. The ones that the data shows are hypertension and diabetes, in addition. And so, but in many hypertensives and diabetics, there's heart and lung disease, and certainly blood vessel disease as well. So the underlying condition, and then the one independent of underlying condition, is how old you are. Now, I think, again, I've not seen this, so I want to make sure I'm not making some absurd pronouncement. I think that much of the elderly issue is if you also have an underlying condition. So if you're an 80-year-old who is completely well, who does marathons and stuff, that 80-year-old just statistically is more likely to get it than a 40-year-old and get sick. But most 80-year-olds do have one or more chronic diseases. Over the age of 52 people have chronic disease, or 50% of people have chronic disease. So I think if, in summary, it's chronic disease, small areas, duration, and age. Now, then the question of race and ethnicity, and that's obviously complex because there are there are correlated issues of race and ethnicity. There are areas, for example, of New York City where COVID seems to have spiked in a Jewish population that are very, very, but is that because they went to temple a lot? I don't know the answer to that. People have talked about people of color getting more likely to have COVID, or at least to get sick from it, than people who are not of color. those are the things that people talk about. What I don't know is sort of teasing apart some of that of what's really going on. But those are the risk factors people talk about.
All right, Doc, we're going to ask you to stay on the line for a minute. I just want to just give some credit to our sponsors, and we'll continue our conversation. So just stay on the line. We'll be hearing from our partners for just about a minute, and then we'll be right back with you. When we come back, we want to talk some more about the vaccines in terms of where you're at in the USA, some information you may want to share with us about that in terms of perhaps even the issue of storage and the movement of the vaccine. We're told that in some cases you may have to have 2 doses. So, Doc, stay on the line. We'll be right back with you in just a moment, just about a minute or so, as we want to hear from our partners now, and then we'll continue right here on Voices.
Thank you, sir.
Thank you very much. All right, you're listening to Win FM. It's 90.9 on your dial, and we're speaking to Dr. Arthur Tim Garson, Professor, Management Policy and Community Health, University of Texas. And we want to continue our conversation in just a moment. Let's hear from our partners.
Friday, shop away. Take 2 days to shop your way. Huge savings for today. We're always so nice. We're treating you so right. Let's try today. Celebrate Friday with 25% off this Friday and Saturday at the TDC Home and Building Depots. Terms and conditions apply. See stores for details.
Every day, your immune system is compromised. You use up vitamin C quickly and even faster with stress and cold. Burst back into life with Halib Orange. Burst back into health with 1,000 milligrams of vitamin C, as much as in 12 oranges. Each effervescent tablet is bursting with fresh fruit flavor, sparkling orange, lemon, and sugar-free blackcurrant. Also suitable for diabetics. Health never tasted so good. Halib Orange, bursting with flavor, bursting with health.
You're tuned to Win FM. It's 90.9. I'm Clive Backus, and we're in the company of Dr. Arthur Tim Garson. Dr. Garson, once again, thank you so much for sharing your time with us this morning. Let's get now to the issue of vaccines. What's the latest update? We know we've heard from some pharmaceutical companies saying 95% successful. Of course, the big expectation now is just how soon will these vaccines be distributed, and who's going to get them first?
Well, we dealt with that a little bit before the break, so let me make sure that that I tell you what at least I think I know and what others know and what people don't know. The first vaccine that has been applied for is the Pfizer vaccine. The Pfizer vaccine requires 2 doses and requires very, very cold storage. That again, I imagine, I can't say I'm certain, I imagine Pfizer has figured that out. Pfizer knows that, they've had to distribute that in very, very, very cold conditions, and they must know how to do that. I myself don't know how that's done, but it's important, and I cannot in any way imagine that a company as good and as big as Pfizer hasn't figured out, well, yes, you require very, very, very deep cold in order to make this thing to keep it okay. There are little strips that you can put in with the vaccine to make sure that that cold has been maintained. So you can do that. Yes, it does require 2 doses. They're about a month apart. And my understanding is that the meeting of the U.S. Food and Drug Administration is December 10th. They have said that, now, it's a little hard to say, well, of course they're going to approve it. But that's why they have meetings. That's why they have data. So I don't know if they're going to approve it. If they do, I'm assuming they will. I've not heard anything from anybody that would make me think they won't, but they haven't. So, I mean, we've got to first understand that they actually have to approve it. Then the Center for Disease Control and Prevention, they've said that within a couple of days after that, like December 12th, they're going to come out with recommendations recommendations to states of who ought to get it first. But then the state is going to determine for itself how they're going to distribute it. Of course, it'll be a partnership between the federal government and states of how to distribute the vaccine in the most efficient and effective way. I don't know that. I'm not. It's not something I know about, and so I don't want to overstep what I do and don't know. But I think that states will make that determination. There are now how quickly after December 12th it will be distributed. I simply don't know. I think that Pfizer is going as fast as they can. The other one early out of the gate is Moderna. They have a similar, Pfizer, I believe, was 90%, Moderna, I guess it was Pfizer that came out first at 90%, Moderna came out at 94.5. There is a third one, AstraZeneca, that very, very interesting to me. And, the data are the data. When you've got 20 or 30,000 people in a study, the data are what they are. The data are that the regimen of doing half a dose, it also requires 2 doses, but doing a half dose in the first one and a full dose in the second one a month apart was actually more effective than doing 2 full doses. I'm sure the immunologists understand that one. I don't. So I don't want to be talking about things that I have no idea about. But that one with that dosage regimen was 90% effective. And so I am very encouraged. Now, the other thing that, again, remember we talked about safety. And what we have not heard at all are any data that it is that bad reactions have happened at all. Now, to me, you'd say, well, I don't trust these drug companies. I don't trust. This stuff is hard to hide. There are, these are not the drug companies actually examining the patients. These are regular old docs. And so I'm not, I've been doing this stuff for too long to say, Pollyanna and everybody is everybody washes their hands 8 times a day. But I think if there were major complications, there are too many people and too many companies involved that if, remember, back in about 4 months ago, I guess, 3 or 4 months ago, there was one person in the UK who came down with a spinal cord disease that made the newspapers. And, that was one person, and that even one person out of that size would have been very significant. It turned out that they looked very, very carefully at it. They suspended the trial, but they decided that that was not related to the drug. So I'm not playing Pollyanna here. I'm not saying, well, my goodness, everybody always tells the truth about everything. But I think there are too many different companies with too many people and different people looking at different data that this one's pretty hard to cheat. I think that this one, could I be fooled? Anybody can be fooled, but I've got I'm pretty certain that and again, the drug companies, it's not just the drug companies. They're independent people looking at this. The ones that came out, for example, that said the Pfizer was 90% effective, that wasn't Pfizer. That was independent people that get chosen for their independence, called a Data Safety and Monitoring Board, And every big trial has those people. Pfizer didn't know how effective it was until they announced it to the world, or they announced it to Pfizer the night before. So all of these large trials have independent people who have nothing to do with Pfizer. They probably don't even, I don't even know what Pfizer makes, but, they probably aren't even allowed to take a Pfizer pill. So they're very independent. And the fact that there are 3 of these out there, and that's at least 3. I'm sure there are many more that are out there that we haven't heard from. So in summary, I would take it. I'd line up first as I could, assuming that they are approved, that a drug is approved by our FDA, and that Tony Fauci gets on television and tells me to take it.
Now, when last have you had something on this scale in the USA?
Oh, I'd say never.
I thought so.
I'd say never. And I would tell you this, Clive, that has, and I'm not, let's again not oversell what I do and don't know. It feels to me that this vaccine technology is new and may be really important for the future of other communicable diseases. And so, this happened in record time. And I people have dumped on the federal government in the U.S. for a lot of things, but they did put a lot of money into these trials and did not stand in the way of getting them done. So the drug companies get tremendous credit, I believe, and at the end of the day, so do the FDA and the CDC. I think this was a time, that particular part of it, that has gone well. Now, the recognition, the testing, the way in which it has the COVID itself has been handled has been awful, just awful. So I'm not. That to me is separate from the vaccine initiative.
Tell us a bit about your thoughts on the health sector in the US of A. We saw these horrendous pictures on the internet and on television of health workers battling COVID-19 conditions, escalations, and then, of course, there are other demands being put on these workers as well. Share some thoughts with us today.
They all ought to get medals. They all ought to get bonuses. Anybody who comes into contact with a COVID-19 patient should get a bonus. My hats go off to these people because there is a risk. And I think from the data that I've seen, fortunately, if the personal protective equipment, the PPE, is available and used, the frontline healthcare workers actually have a lower likelihood of getting COVID. So it works. But just think for a minute, and fortunately, hopefully neither you nor hopefully any of your listeners have ever tried to take part in resuscitating a patient who has had a cardiac arrest. I've probably done it more than 100 times, and you remember virtually every one of them. This is not, these people who are trying to keep people healthy, every single patient takes something out of you. And the ones that die take immense parts out of people. The ones that live, you obviously get tremendous joy. The ones that die, it is a very personal thing. So these people are under immense pressure. And nobody signed up for this, Clive. Nobody signed up for, 5 cardiac arrests in the same shift. Nobody signed up for that. And so my hat's off. I've trained these kinds of people. I've worked with these kinds of people. What I dealt with when I was very active in patient care was children at risk for sudden death. So I've dealt with this. Every single patient takes something out of me. So my hat's off to them.
A related issue, Doc, and thank you for that. That's a very emotional chord you struck just moments ago. I could actually understand where you're coming from, and I myself know healthcare workers, and I have relatives who work in the healthcare sector as well, so I know exactly what you're talking about. Now, just speaking to a related topic, you spoke about people having underlying conditions, being more at risk. Speaking about underlying conditions in the Caribbean and in St. Kitts and Nevis, non-communicable diseases, hypertension, diabetes, and obesity, basically, taking a toll, heavy toll. And I know that you have dealt many years now with community health issues. One of the issues we're dealing with is the issue of what do we eat? How much do we eat?
Yes.
How much do we eat? Where do we get our food from? What can we afford? What can't we afford? Do we eat when we're angry? Do we eat when we're hungry? Do we eat when we're happy? Do we eat when we're vexed? When do we eat and what do we eat, Doc? Talk a little bit how we can tackle this issue.
Clive, that one's easy. The answer is yes to all those. You know, we eat, and you know it's different than smoking. You cannot smoke. That one, and I used to say, you know, I smoked for 3 years in college. I know what that's like. That is really hard to stop. You can't tell people to stop eating, right? So it's not a binary. It's not a yes you do, no you don't. Smoking is, you know, you can take people. You take 100 people and you put them in a very intense anti-smoking campaign. You can maybe get 30 to 40% of those people to stop smoking. Obesity is nowhere near that. Obesity is really difficult. And you know, there, as everybody, you know, the non-communicable disease world knows, they're obviously related. Obesity, hypertension, diabetes, kidney failure, heart disease. Those are all related. If you could, I mean, the data that came out now, it's probably 5 or 6 years ago, where the U.S. life expectancy for the first time since the Civil War went down. And it went down, the first year it went down because of diabetes and obesity. Life expectancy went down. Wow. And so, you know, in the second year it was drugs, it's drug abuse. And now it's sort of both. We don't get to claim brilliance in this area, Clive. We're 43rd in life expectancy in the world. We don't do all that well. And so to say, oh, the United States, the shining city on a hill, we're 43rd in life expectancy, 35th in infant mortality. Those are the two big healthcare indices. So we don't get to hold up and say, oh, look how good we are. Much of that, not all of it, much of it in the U.S. is related to no access to healthcare. So remember, we have a bunch of people who are uninsured who don't have, there's a difference between healthcare access, which means can you see somebody, and healthcare coverage, which means do you have health insurance? Those are two different things. And so, you know, in the U.S., people talk about, well, 100% of people have access if they can get to an emergency room. That means they can see somebody. Well, that's not the right place to go for your preventive care for diabetes, but they have access to care, whereas 20, 30 million people in the U.S. have no health care coverage, which means they don't have health insurance. So now those two, if you then apply those to St. Kitts and Nevis and the Caribbean, the notion of overeating is rampant everywhere. And it's not, I've done, I think when we were talking before we got on the air, we have this program called GRAND-AIDS, GRAND-AIDS, conflict of interest. I'm the chair of that, so I want to, has nothing to do with the University of Texas. But we've been doing this for 10 years. We've actually talked with the folks in St. Kitts and Nevis. The issue here is to take people who are like community workers or nurse aides or something and have them work one-on-one with people. Now, the most successful we've been is in getting people to take their medicine after they go home from the hospital and keep them from being readmitted. But now if you extend that to obesity, smoking, we now know that one-on-one, an almost coach, is about one of the best ways to attack obesity and smoking as well. You have somebody that comes and talks to you and helps you cook or helps you stop smoking. That's an effective way to do things. You know, I could get myself in trouble here, but it won't be the first time. You know, if I were, never mind, you know, not St. Kitts and Nevis, but any government, I would try and make it easier for fast food to come up with healthy things to eat. And we all know, and St. Kitts and Nevis is, you know, I mean, fried chicken. I have nothing against any of those restaurants. But if you could just eat good-tasting baked chicken, you're way along the road. The one that just blows me away is French fries. French fries are absurd. You know, and, you know, it's unfortunately with, you know, one of the potato chip companies, you know, their big slogan used to be, bet you can't eat just one. That sort of seems to be the problem with French fries as well. If you could just eat 5 instead of 50, French fries are absurdly fattening. And so if we do this thing with Grandaids where we actually ask people what their favorite restaurants are, and then we create a guide for them of what they can eat. So it's a calories and fat and sodium guide. We actually print it for them of not what they can't eat when they go to XYZ fast food place, but what they can. And they love it. You know, people love that of printing out, well, wow, you mean I can go to XYZ place, and if I just ordered this, I'd be in much better shape. You know, it's much healthier. So rather than saying, you know, and we label that stuff yellow and green, we don't concentrate on what's red. Everybody knows what's red. But what's more interesting to me is what's yellow and green. You know, what can you eat when you go to XYZ fast food place? I don't think it's and again, this is obviously a cultural St. Kitts and Nevis question of can we get people to cook more at home? Probably not. That's just the way life is today. People do eat fast food. People do pick up food. It's the way it is. Well, why not make the food that they buy and pick up healthier? That's what I do. And you know, there are people who weigh 98 pounds that, you know, want to eat the triple burger with fries. Why not? You know, this is, you know, we talked about this earlier, Clive, about, you know, personal freedom. No way in the world would I want to abridge personal freedom, especially in these areas. But if people want to learn how to do it more healthy, we can help them do that. You want to eat triple burgers and, you know, you don't want to abridge that. That's not fair. But if people say, you know, I just can't figure out how to do this, it's easier, it's cheaper, you know, I think that becomes a cycle where people say, well, I just don't have access to low-calorie food. Yeah, you do. You know, if people decided they wanted to eat low-calorie food, the places that sell it would figure out the supply and demand, and guess what? If people really wanted it, the people that sell groceries would figure out how to, you know, if that's what they want to buy, they figure out how to make it that way. You know, tomatoes are not inherently more expensive than French fries.
I guess what you're saying, Doc, and I understand why people are picking up things that are close at hand, easy to get their hands on. The price is seems to be right. The price that you're paying for it, not the price you pay for it later, but the price you're paying for it when you buy it. But you know, we've had this conversation. We know that in some parts of the world, some people have imposed specific tariffs on too sugary stuff, too starchy stuff. But some people,
Yes.
but some people still seem to feel that, I can't afford the good stuff. So you raise a good point in terms of trying to make it affordable. But once people continue to buy the sweet, starchy stuff, what is the incentive for not selling it?
Oh, nothing. Absolutely nothing. No incentive at all. Public policy, unfortunately, I teach public policy. Public policy, unfortunately, is about money. It really is. You'd like to do the right thing. All of us involved in public policy would love to do the right thing. But doing something that's right and more expensive very frequently doesn't work very well. So we have to figure out a way to make whatever is healthy less expensive. And I believe, I don't know this, I know we did create in Houston, in low-income neighborhoods in Houston, in corner grocery stores, we created a program of labeling the food red, yellow, and green on the shelves. And interestingly to me, and this was 5 corner grocery stores. This was not 500. But the people that owned the grocery stores just loved it. They loved the idea that they were contributing to the health of the people who came. But what I don't know, I just don't, and they may have analyzed it, but these were not grocery stores that had immense computer systems. What ultimately happened to their profit margin, I just don't know. But they kept doing it. And so, if you can imagine, you walk into a grocery store and, somebody has got to figure out what that coding means. What is red? What is yellow? What is green? And the dietitians of the world go nuts over that. Is it 419.8 calories, or do you use fat, or do you use trans fat? Simple is sometimes better. Good old calories are pretty good. So there are, we at least, I think they're actually still doing it in these places in Houston, where you label things according to their calories and or sodium. I think, the obvious thing you'd like to do at a broader, perhaps government level, is actually measure whether that does any good. People liked it, but was it cheaper? Did people, did their blood pressure go down? Did their weights go down? This was a very early thing where people were just measuring, could you do it? And did people like it? But ultimately, whether you can do it and like it is not what you want to know. What you want to know is whether people who are obese lost weight, and whether the person selling the goods continued to make enough money. So those are the outcomes you'd really like to know. But things like that could be done, and again, with health coach, individual people of, those people, whether it's a Grand-Aid or something else, of people who help folks to remember to take their medicine, to cook healthy, to quit smoking. We do know that those work better with a person involved. We're coming out with a paper in about 2 weeks where we looked at apps for heart disease. The apps that, for diabetes, what should you eat, all that kind of stuff, they don't work very well. And people don't use them for longer than 6 months. And so the ones that do work, and this is now based on a lot of data, the ones that do work, and it's a good thing that I didn't collect the data, because somebody would accuse me of fudging the data because of Grand-Aids. It turns out that the apps that work best, and they don't work very well, have a person involved with them as well, like a diabetes educator, a Grand-Aid, something like that. And so, you say, well, you have all these apps, and they don't work all that well. So I think there are things to do, Clive. I think in St. Kitts and Nevis, there's things that can be done. I would not want to be in the position of being the guy that was trying to abridge personal freedom. But if somebody wants to, we got plenty of things we could do.
All right. Well, thank you very much for talking to us today, Dr. Arthur Tim Garson. We're out of time, but I can't let you go.
Well,
I must say this: it has been a privilege talking to you. But I can't let you go before you just offer a 1 minute parting shot, if you like, to our listeners.
My parting shot is I've been to St. Kitts and Nevis like 7 times, and I'm looking forward to the 8th. I'll do my next with you, Clive, in person.
All right.
You have marvelous people there. I mean it. You have marvelous people, and I hope that those people eventually can deal with hypertension, obesity, diabetes in very positive ways. I think we can help.
Well, thank you very much for your time, sir, and all the very best to your team. It was a pleasure talking to you today.
Pleasure.
All the best indeed.
Yes, sir. Thank
all right,
you.
take care.
Great.
Bye-bye, sir. All right, that's Dr. Arthur Tim Garson, medical doctor, professor, management policy and community health, University of Texas, elected member, National Academy of Medicine, Institute of Medicine. We're talking this morning all things USA, vaccine, COVID-19, health, and of course we segued into the issue of non-communicable diseases. We want to thank him very much for his time today. Thank you for listening, and we want to say thanks to our sponsors as well as we welcome you now to the headline news.
You found the sound. 98.9. Win FM.
We now bring you the Win FM Headline News. The Win FM Headline News is brought to you by Caribbean Alliance, KDP Enterprises, The Grange, Carib Brewery, CNC Trading.
Without limits, happy and free. The skin you're in with no apology. The one to seize the day. Grab an LLB. Live, love, be. With LLB. Live, love, be. Live, love, be. Be who you know you can be. Grab an LLB. Live, love, be. Angostura, lemon, lime, and bitters. Live, love, be.
Did you know that the Grange Healthcare Facility is the first purpose-built non-governmental healthcare organization on St. Kitts, offering 24-hour nursing, therapeutic, and residential care for older adults? It's situated at Otley, 7 miles east of Vastair in beautifully landscaped surroundings. The Grange has a team of highly trained professionals and provides care that's rated as being comparable with UK and North American standards. The Grange offers varied accommodation to suit your individual needs, and our all-inclusive packages make the cost of care per hour the most competitive on the island. Services include convalescent care for all ages, daycare facilities for older adults, rehabilitation services, and training and continuing education for healthcare providers. For more information, call 466-5525 or 465-8020, fax 466-8221, or email thegrangehealth@gmail.com, or visit our website at www.grangehealthcarefacility.com.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
Protect your lifestyle with Caribbean Alliance Insurance. Till you walk with a low reputation and service for second to none. Securing you is our mission. People that you can trust, your business, property, we got you covered. Motor or personal, whatever it is, we got you covered. 130 years in this business, we've got you covered. For all your insurance needs, visit or call us at 465-26
or 469-5303. Delia Walwyn, people you can trust.
Shipping your cargo shouldn't be a hassle. It can be as easy as a single call to Amerijet International, your worldwide cargo transportation solution. We provide all the services you need to ship your goods anywhere in the world. Whether your shipment is fresh, frozen, large or small, alive or hazardous, you can count on Amerijet to deliver it safe and sound. Amerijet International, by land, sea or air. We get it there. For more information, visit us online at www.amerijet.com or call us at KDP Enterprises, telephone number 466-9595.
With the confirmed case count now at 22, officials are encouraging people of the Federation to commit to the protocols in place. In a release from the Nevis Island administration, Premier and Minister of Health Mark Brantley urged our people to continue to be vigilant and to adhere to all protocols as we fight this pandemic together. Brantley was commenting on the November 24, 2020 announcement by Chief Medical Officer Dr. Hazel Laws of the two most recent positive lab results, and Brantley said authorities were expecting additional cases of COVID-19 once the country reopened its borders to commercial travel. He commended the work of health officials, saying, "Thankfully, our health protocols have been robust enough to detect and isolate cases and pursue effective contact tracing. All cases thus far are imported cases, and there is still no community spread in our country." The Department of Gender Affairs will participate in an activism campaign against gender-based violence as the annual 16-day campaign starts from November 25th to December 10th, 2020. This year's 16-day campaign operates under the theme Orange the World, Fund, Respond, Prevent, Collect, and will highlight the need for the elimination of violence against women, children, and men. Quoting statistics from the Royal St. Christopher and Nevis Police Force Special Victims Unit, in 2018, 120 cases of domestic violence were reported. In 2019, 87 cases of domestic violence were reported, and during the peak of the COVID-19 pandemic from January to June 2020, 106 cases were reported during the 6-month period, which indicates that the pandemic had resulted in an increase in cases. The Department of Gender Affairs has organized several activities during the 16 days. On Wednesday, November 25th, a statement by Minister of Gender Affairs et al. Eugene Hamilton on the Working for You program addressing the topic, the effects of domestic violence on the vulnerable population, and the debate of the Model Sex Harassment Bill by the St. Kitts Youth Parliament Association. On Friday, November 27th, at the Independence Square, the display of silent witnesses, figurines of deceased victims of domestic violence, and the Domestic Violence Pledge Board, where passers-by can sign to indicate their support in the fight against this social ill. November 30th, a presentation of partial scholarships will be made to 2 survivors of domestic violence who are now attending tertiary institutions. On December 4th, a collaboration with the Nevis Department of Gender Affairs to host Wear Orange Day, which encourages the public to wear orange, the awareness color of the 16-day campaign, as well as Nevis's display of silent witnesses and Domestic Violence Pledge Board. A second Working for You panel discussion addressing the family on December 9th, the day before Human Rights Day on December 10th, closing the 16-day campaign.
In regional news,
in news from the Bahamas, the count of daily new infections continue to drop, but officials suggest a second wave still churns. This report from Eyewitness News, Bahamas.
Health officials say we're winning the fight against the coronavirus. Their new position comes after a drastic drop in cases yesterday, alone only recording 29 cases. Tonight, we take a closer look at the numbers and what they all mean. Here's Matthew Moxie.
We are seeing a downward trend in the cases. That is the news. We're also seeing decreases in hospitalizations and persons under investigation.
The holiday season bringing good news for the Bahamas as the number of coronavirus infections in the country are once again falling. But with continued double-digit daily new cases, Infectious Disease Program Director Dr. Nakia Forbes says we're not entirely out of the second wave.
But we must not let our guard down in terms of the COVID prevention tips, because if we relax and people go back to socializing and COVID spreads, and then cases will go up again. So there are things we have to do to keep these numbers down.
New COVID-19 cases fell by 29% last week compared to the previous week. New Providence also experienced a 42% drop in cases last week, the fifth consecutive week of declines. The positivity rate also showing promising signs, dropping from over 22% in September and October to as low as 8% in recent days. However, the race is not yet won. Researchers say adequate testing and contact tracing take place when test rates remain around 5% or lower for 2 weeks. But Dr. Forbes points out that as more people take rapid antigen tests, it presents a bit of a challenge. This as she reveals these tests are not reflected in the overall testing figures.
They shouldn't be used for asymptomatic persons really at this time. That hasn't come into practice recommendations yet. However, the thing about them is they are more available, accessible, and affordable. And so persons could be doing those tests, and we need to reconcile the data and the information around those tests, and the context. Are they being tested? Are they symptomatic? Or did they have an exposure? So that we can properly monitor the outbreak.
The second wave of coronavirus cases still leaving a bad taste in the mouths of healthcare workers who say they are still bracing for impact.
We still have some doctors out who are ill. While the numbers are down, we expect that this may change, and we are on guard for that. And we're still mindful that our staff is being affected negatively by secondary exposure. So that's a concern, always a concern for us.
Matthew Moxie, Eyewitness News.
In scholarly news, a Barbadian has been named the 2021 Rhodes Scholar. This report from Barbados Today.
Barbadian Trey Cumberbatch is the 2021 Rhodes Scholar for the Commonwealth Caribbean. Governor-General Dame Sandra Mason made the announcement yesterday. The 23-year-old beat out two St. Lucians, a Grenadian, a Dominican, a candidate from Antigua and Barbuda, and two from Trinidad and Tobago. Dame Sandra said all the candidates were well qualified for the scholarship.
Each one of them could easily have been given the scholarship because they have vision, and we know that wherever they go, as our Barbadian anthem says, they will do credit to our nation. This year, it is my extreme pleasure to say that this scholarship, the Rhodes Scholarship, has been awarded to a Barbadian, a young Barbadian, Trey Cumberbatch.
Cumberbatch said he plans to pursue a master's in evidence-based social intervention and hopes to make a noticeable impact on the mental health support system in Barbados.
That the Minister promised to mental health policy, I very much want to be at the forefront in terms of the development of that policy and making sure that that policy meets the mental health needs of the Barbadian population. I think as a society and a culture, we've ignored it for far too long, and we need to have it written in policy that mental health is important, and we have things in place to make sure that people have access to healthcare and it is to mental health care, and it is affordable. So the policy program at Oxford would definitely help me in terms of how to formulate a social policy, how to evaluate a social policy, and make sure that it utilizes the country's resources to the best of its ability.
While grappling with a global pandemic, health officials around the region also warned of dengue fever, with St. Vincent and the Grenadines being one of the islands that have suffered from an increase in cases related to dengue. A total of 1,617 laboratory-confirmed cases of dengue fever has been recorded as at November 14th, representing a 462 jump in cases recorded 1 month prior. However, officials are now reporting a drop in the number of dengue cases. This report from SVG TV News.
Health officials here are reporting a decrease in the overall cases of dengue fever. Chief Medical Officer Dr. Simone Keyser Beach told SVG TV News today that as of November 14, 2020, there were 1,617 laboratory-confirmed cases of dengue fever with 7 recorded deaths. The most recent death was that of a 10-year-old female who was admitted to the Milton Cato Memorial Hospital on November 14th with symptoms of dengue fever. The child is also said to have underlying heart conditions. Dr. Kizza Beach said that there has been a decrease in weekly laboratory confirmed cases of dengue fever and also a decrease in clinically diagnosed cases.
We have also noted a decrease in the number of laboratory confirmed cases, and starting from week 41, which was October the 10th, when we had 194 cases for that week, and subsequent to that, we have had a constant decrease in the number of cases. We have also noted a decrease in the clinically diagnosed cases of dengue fever over that period.
The CMO said Pembroke and some other districts continue to have the highest incidences of the viral illness.
Where we are seeing the cases still in the Pembroke, Kingston and Calico areas, and now Mariqua and Chateaubelair health districts also have moved ahead of, say, Georgetown. Continue to work in terms of our vector control unit, in terms of intensified integrated vector control program, where we focus on source reduction, that is to decrease the amount of mosquitoes we have. As we know, the mosquito spreads the dengue virus. We have noted some decreases in the mosquito breeding indices throughout the country, starting from the first half of November, and this we think is an indication of the effectiveness of our increased fogging and the messages to the communities to decrease the breeding sites.
The CMO is encouraging Vincentians to continue cooperating with the Ministry of Health in stopping the spread of dengue by getting rid of the Aedes aegypti mosquito, which carries the dengue virus.
We would like the continued cooperation work of the general public to ensure that we see sustained decreases in both the indices and the resultant dengue infections. So we ask persons to continue to inspect their homes, remove any stagnant water. Persons should continue to wear their insect repellent, their long sleeves, long pants. They should seek care early on if they think they're having any features of dengue. And of particular concern would be persons with pre-existing conditions such as sickle cell disease, kidney problems, heart disease, or persons who have previously had dengue or Zika, or children of mothers who have had dengue, because we know that these persons are at increased risk to develop severe dengue fever.
We now bring you this international report.
Scotland has become the first country in the world to make female sanitary products free. It means the authorities have a legal duty to ensure items such as tampons and sanitary pads are available without charge to anyone who needs them. Tanya Dendrinos reports.
An historic vote, years in the making.
The result of the vote on motion 23328 in the name of Monica Lennon is yes 121. There were no votes against, there were no abstentions. The motion is agreed and the Period Products Free Provision Scotland Bill is passed.
Monica Lennon seeing out her vision, with Scotland becoming the first country in the world to make period products free for anyone who needs them.
Menstruation is normal. Free universal access to tampons, pads and reusable options should be normal too. Period dignity for all isn't radical or extreme. It's simply the right thing to do.
Period poverty is an issue the world over. Women in both impoverished nations as well as those in developed countries unable to afford suitable sanitary products, resorting to toilet paper, socks and even newspaper. It affects self-esteem and even keeps girls from school, having a significant impact on their education.
I think we sit in admiration of Scotland. I think that it shows and will lead the rest of the world into how we look at menstruation, even the conversations around menstruation. I think it's fabulous.
Obviously, there is still a lot of stigma attached. Lots of people don't like to talk about it as an issue generally, let alone the fact of period poverty.
Period poverty is multi-pronged. So we look at period poverty, and while we can give access to sanitary items, we also need to remove the shame and stigma around menstruation. We also need to educate so that our girls and our boys are learning about menstruation in the way that they can hear it, take it in, and remove the shame and stigma around it.
The benchmark now set and ready for the rest of the world to meet. Tanya Dandrinos, BBC News.
Tel Aviv is Usmain Baraka's home. He works as an advocate for African students, but his life here is precarious. His asylum application, lodged in 2013, has never been ruled on. He needs to renew his temporary residency each year. He fled Darfur as a child after his father and brother were killed in militia attacks. He fears what would happen if he were forced now to return to Sudan.
If Israel would decide to deport us back, we don't know where to go because the genocide is still happening, and we even also taking different report from our relative families who is living in IDP camp in Darfur and also in different areas in Sudan. So it's still genocide happening, it's still war happening.
Baraka's concern stems from the normalization deal announced at the White House last month between Israel and Sudan.
Do you think Sleepy Joe could have made this deal, baby?
Prime Minister Benjamin Netanyahu says he wants to address migration issues as part of the process. Ministers have long sought the removal of tens of thousands of Africans they call infiltrators. The Interior Ministry says of the 6,285 Sudanese, 1,000 have been granted temporary residency. More than 5,000 others are awaiting answers to their asylum claims. Sudan's former president, Omar al-Bashir, was deposed last year and awaits possible trial on war crimes charges. But activists say the Israeli government itself has reported continued insecurity in the country.
Israel will not dare to deport genocide survivors with open asylum claims without checking their asylum requests. This is like a kind of red line that I don't believe the country will cross, despite the so many violations of the international law.
Israel has failed before to make good on domestic promises to expel Africans. 3 years ago, it issued an ultimatum: accept deportation to a third country or face indefinite detention. The move brought thousands of protesters to the streets and was eventually defeated in the Supreme Court. The detention center in the southern desert has since been closed. Israel's Prime Minister's office declined our requests for comment ahead of Israel's first direct talks with Sudan since the normalization deal was announced. In the meantime, for the thousands of Sudanese here in Israel, it means a continuation of an uncertain and contingent life, aware that their futures are reliant on decisions made by governments and courts. It's a way of life they've got used to now over many years. Harry Fawcett, Al Jazeera, Tel Aviv.
Addiction, squalor and misery. Under this bridge in the west of Kabul, lives left broken by drugs. For years, heroin use has been a major problem here. But now, many are turning to a new, cheaper fix: crystal meth.
دیگه اینا لیدنی 3-4 سال دیگه شیشه زیاد شده بازوام کلا طبقه جوان.
Afghanistan already produces the vast majority of the world's heroin, made using these poppies. Now it's emerging as a major producer of crystal meth, another dangerously addictive illegal drug. The boom has been fueled by the discovery that this common Afghan plant can be used to make the key ingredient, ephedrine. Poor Afghans in rural communities can produce it in makeshift labs like this one before selling it on to be refined into meth.
So this is a classic ephedrine lab. It has all
Using satellite images, a team of researchers has been tracking the growth of the ephedrine labs. They found more than 300 in one district alone.
The realisation that you could produce methamphetamine from a wild crop in the mountains, this ephedra crop, has been a fundamental game changer. You've gone from the use of imported over-the-counter medicines at a high cost to being able to use a low price commodity that is growing in its abundance and simple chemistry.
In the past, the US has carried out airstrikes on suspected drugs labs. The Taliban are believed to charge them taxes. But the labs are so easy to rebuild, the campaign soon stopped. Meth with suspected links to Afghanistan has been discovered as far away as Australia. Here, a seizure with a street value of more than $50 million, dissolved in mineral water bottles.
What we are seeing and what we are monitoring is an increase in methamphetamine coming from Afghanistan and the surrounding countries around there.
And the forensic analysis you've done on the meth, does it suggest that it was produced using this ephedra plant?
So all the profiling results that we have received from these seizures indicates to us that the starting product is the ephedra plant. Obviously for us that yields critical information.
Meth from Afghanistan may be exported around the world, but it's causing misery back here too. Continuing instability means the amount produced and the number of lives ruined is likely to rise. Sikandar Kamani, BBC News.
That was the Win FM Headline News, brought to you by KDP Enterprises, Caribbean Alliance, Carib Brewery, CNC Trading, The Grange.
Shipping your cargo shouldn't be a hassle. It can be as easy as a single call to Amerijet International, your worldwide cargo transportation solution. We provide all the services you need to ship your goods anywhere in the world. Whether your shipment is fresh, frozen, large or small, alive or hazardous, you can count on Amerijet to deliver it safe and sound. Amerijet International, by land, sea or air. We get it there. For more information, visit us online at www.amerijet.com or call us at KDP Enterprises, telephone number 466-9595.
Protect your lifestyle with Caribbean Alliance Insurance. Daily Wall with a low reputation and service for second to none. Securing you is our mission. People that you can trust, your business, property, we got you covered. Motor or personal, whatever it is, we got you covered. 130 years in this business, we got you covered. For all your insurance needs, visit or call us at 465-2631 or 469-5303. Delia Walwyn, people you can trust.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
Did you know that the Grange Healthcare Facility is the first purpose-built non-governmental healthcare organization on St. Kitts, offering 24-hour nursing, therapeutic and residential care for older adults? It's situated at Otley, 7 miles east of Vastair in beautifully landscaped surroundings. The Grange has a team of highly trained professionals and provides care that's rated as being comparable with UK and North American standards. The Grange offers varied accommodation to suit your individual needs, and our all-inclusive packages make the cost of care per hour the most competitive on the island. Services include convalescent care for all ages, daycare facilities for older adults, rehabilitation services, and training and continuing education for healthcare providers. For more information, call 466-5525 or 465-8020, fax 466-8221, or email thegrangehealth@gmail.com, or visit our website at www.grangehealthcarefacility.com.
Without limits, happy and free. The
opportunity, the one to seize the day. Grab an LLB, live, love, be. With LLB, live, love, be. Be who you know you can be. Grab an LLB, live, love, be. Angostura, lemon, lime, and bitters, live, love, be.
From the South, 98.9 FM.
Like New Steam Cleaning and Power Washing Service specializes in high-pressure washing and floor care, green and chemical cleaning solutions for upholstery, bathrooms, carpets, and windows. We also remove heavy grease off kitchen hoods and extractor fans, or mold and mildew from your home or office. Like New Steam Cleaning and Power Washing Service, renewing all surfaces. We are the steam experts. Call us at 765-4925 or email likenewsteamcleaning@gmail.com. You can also like us on Facebook. Christmas specials on pressure washing services.
A relatively dry and stable air mass will continue to linger across the area and restrict any meaningful shower activity over and around the islands during the next 24 hours. Today, partly sunny skies in general with a 20% or slight chance of brief afternoon showers. Tonight, mostly fair and cool conditions. Winds east and northeast at 6 to 12 knots, becoming lighter and variable or even calm overnight. Seas not exceeding 1.5 meters or 5 feet. Sunset today will be at 5:35 p.m. Sunrise tomorrow at 6:22 a.m. That's the weather forecast for today. Comes with the kind compliments of Breed Easy.
Like New Steam Cleaning and Power Washing Service specializes in high-pressure washing and floor care, green and chemical cleaning solutions for upholstery, bathrooms, carpets, and windows. We also remove heavy grease off kitchen hoods and extractor fans, or mold and mildew from your home or office. Like New Steam Cleaning and Power Washing Service, renewing all surfaces. We are the steam experts. Call us at 765-4925 or email likenewsteamcleaning@gmail.com. You can also like us on Facebook. Christmas specials on pressure washing services.
WINN is 98.9. 98.9 is Win FM.
Savings at the Hossford's Building Center. Paint it, tile it, improve it. Sales event happening now. Yes. Come to Hossford's Building Center now and get savings of 25% off all paint and up to 75% off all tiles. Yes. Nothing's are gonna keep at Hossford's with up to 75% off piles of tiles in all styles and 25% off all paint. Come now and get a chance to win $500 shopping spree at Value Mart with the purchase of 5 gallons of paint or more. That's right. Buy 5 gallons or more of paint and you get a chance to win $500 in free groceries. Starting now until December 31st, 2020. It's your home. So paint it, tile it, improve it. At Hossford's Building and Nevis Center's year-end Paint It, Tile It, Improve It sale. Come now. Save big and simply paint it, tile it, and improve it. The event starts now and ends December 31st, 2020. Terms and conditions apply. See store for details.
Good afternoon, St. Kitts and Nevis, and welcome back to Voices right here on 1FM 98.9. I am your host, Devon Cornelius, and it's Wednesday, November 25th, 2020, and this is the second hour segment of Voices right here on your radio station, 1FM 98.9. I had a fantastic morning today. I had the privilege of attending a mock parliament sitting at the National Assembly chambers at government headquarters, where the St. Kitts National Youth Parliament Association, SKNIPA, held their mock parliament sitting, and they had discussions on two bills. One, the Sexual Harassment Bill 2020, and two, the adoption of a national cultural policy. I think both bills are quite significant and timely, in particular the sexual harassment bill, because today begins the 16 days of activism against gender-based violence, and the government of St. Kitts and Nevis, will be carrying out or facilitating a number of activities to bring awareness or draw attention to gender-based violence. And the activism is from the United Nations. They are the ones carrying out the whole campaign. And this year's theme is Orange the World. Fund, respond, prevent, collect. And if you are joining us via Facebook and or YouTube lives, you will realize I have my orange on today. Orange is one of my favorite colors, let me say. But I decided to help bring attention or awareness to gender-based violence right here in St. Kitts and Nevis by showing solidarity and showing support, of course, by wearing my orange. And I would encourage persons to wear their orange. If you don't have an orange, then fine. These are hard times. I won't ask you to go and buy orange. But find something orange and wear orange to bring awareness and to bring some sort of attention, to gender-based violence, and letting others know that it is real and it is happening within our society. So today, SKNIPA debated that bill, and the presentations that were made were excellent. They presented statistics of sexual harassment among women and men, of course, within the workforce, employees being sexually harassed by customers, and customers being sexually harassed by employees, and employees being sexually harassed by their co-workers, and employees by their employers. And so this is what the entire campaign is about, is to bring awareness and to draw attention to this gender-based violence, persons being sexually or abused violently just because of their agenda. And it is something that we are bringing awareness to. I think it was it was on Tuesday, where the NIA's Department of Gender Affairs, they began the activity, and they spoke about a number of activities that they will be carrying out on the island of Nevis, to join the rest of the world to collectively fight against the violence against women, and of course against men, because men are being abused as well. And so, again, as I said before, the theme is Orange the World, Fund, Respond, Prevent, and Collect. On November 24, they had their launch of the campaign at NEPAC, and it showcased the media that the department has prepared, and they did, I think it was a a artist presentation, or a presentation by Mr. Vaughn Anslin. And so the Department of Gender Affairs on Nevis, they are doing a number of activities to celebrate or to bring awareness to the day geared towards bringing awareness, to gender-based violence. And even though some would say, well, we don't think that is really important right now, and we shouldn't really talk about it right now, I think this is something that really must be talked about, and we should continue to do our part in bringing awareness to this issue that we continue to face right here in our society. As I said, within our workforce, within our schools, within our church, within everyday life, persons are victims of sexual abuse and sexual harassment. I think the Youth Parliament over in Antigua, they debated this bill too some time ago. I think it was just recently, last week. And now we have the Youth Parliament Association right here in St. Kitts debating this bill today. As I said, I was there, and it was a very fruitful discussion. You heard the statistics that were being presented, because I believe whenever you have conversations such as these, you should always have some sort of statistic or statistics to back up what you're saying. And as I said that, I have some statistics here. It says, according to a recent survey, about 1/3 of all working men reported at least one form of sexual harassment in the previous year. Of the 7,809 sexual harassment charges filed in 2011 with the U.S. Equal Employment Opportunity Commission, 16.1% were filed by men. By 2013, this had risen to 17.6%. It says, despite the serious consequences that can stem from sexual harassment, whether it involves men or women, sexual harassment against men is often not taken that seriously. There has been extensive research looking at how sexual harassment can affect women, both in terms of the emotional consequences, economic consequences, financial consequences, and reduced, job prospects. But fewer studies have looked at how men are affected. But it begs the question, what is sexual harassment exactly? Though it can take different forms, it generally falls into three distinct categories. Sexual coercion. Sexual coercion involving job-related threats or bribes to force unwilling workers to enter into a sexual relationship with the harasser. One example of this is when an employer threatens to fire an employee if he or she doesn't agree to sex. While often the most damaging, most harassment tends not to be this blatant. This one is very common within our Caribbean region, and I dare say across the world. You find that there are persons appointed to positions, firstly, because they're qualified, and in order for them to keep that job, they have to engage themselves in some sort of sexual activity to keep their job. And so it makes them feel less than a person, less than a man or a woman, that they have to sell their body to keep their job. They have to sell their body to keep things flowing within the household. And you find that there have been many cases and many instances where persons in workplaces have been sexually abused, sexually harassed. And if they even try to speak up, they get that letter to say, look, come go home. You have unwanted sexual attention involving unwelcome sexual advances towards someone else in the workplace that are regarded as unwelcome or offensive. Now, this includes sexual touching or pressuring for a date, since it can involve threats or bribes, there can be considerable overlap between this category and, of course, the first one of sexual coercion. Then there is gender harassment involving hostile behavior aimed at undermining workers simply due to their agenda. Now, you may have a situation where you work within an entity or an organization, and the head of that organization may be a woman, whether she's the director or manager or supervisor, whatever the case may be. And most of the employees may be men. And they began to disrespect her, they began to harass her sexually just because she's a woman. And there will be some men that feel, well, look, this position was supposed to be mine because I'm more qualified than you. And there are some cases where they're not even qualified, or they don't even have the necessary qualifications and skill set to hold that post. But simply because they are men, they tell themselves, well, look, this position belongs to us, and no female should hold such a position. And you also have some instances where females are harassing other females in the workplace. There's some females today that believe that women should not lead. And I have heard the conversation too many times. And most of the times, I opt out of the conversation, and I try not to be a part of it. I listen, and I listen. And as I listen to these conversations, I will go and I will do my research. For when that day comes to be part of the discussion, I could respond with the necessary data and the necessary statistics to back up what I would want to say. But I find it is very common within our society that there's some women that believe that women should not lead. There's some women that believe that women should not lead. There's some men that think the same way as well. And that is the harsh reality right here within our community. Whether it be into politics, or whether it be in the church, or whether it be in, let's say, education, or school, or anything like that. There are just some women that believe women should not lead. And in my opinion, that's a problem. That is a problem. But speaking about gender harassment, it says, the study says here, and this is from Psychology Today, a website called Psychology Today from the United States. And the research was carried out in it was posted in 2015, but I think it was carried out in 2011. And it was done by Romeo Vitelli, Dr. Romeo Vitelli. It says both women and men have reported experiencing these three forms of sexual harassment in the workplace, with other men being most likely to be the perpetrators. Men belonging to sexual minorities are particularly vulnerable to this kind of treatment, which can also overlap with displays of outright homophobia. Women expressing strong feminist beliefs about issues such as birth control, abortion, or anything that can challenge existing gender biases are especially vulnerable to being harassed. But what about men whose behavior challenges the existing gender hierarchy? Employers and employees can often expect men to act as masculine as possible, and anything that deviates from that is more likely to get them harassed. For people, men who take time off to care for their children may experience more gender harassment in the workplace as a result. Since women are expected to do most of the actual child care, looking after children, men may find their careers affected if they deviate from traditional gender roles. Also, men who openly support feminist causes or who are seen as unmasculine may get harassed as well. And so you see, you have a situation where, you know, there's some men that believe that the cooking and the washing and the cleaning and the looking after the children is just for the women. And that's not the case. I think one hand can clap. That's the saying. One hand can clap. And so as parents of the household, mother and father, husband and wife, boyfriend and girlfriend, whatever you want to call it, it should not be up to the female alone or up to the male alone to make sure things are done within the household. It should be a collaborative effort where you work together to make sure that the bills are paid, the children are being taken care of, and things are being done within the household. But then you have that gap where there are some men who believe that, well, women are supposed to do all the work. And then you have some situations where men are doing all the work, and women are saying, well, I don't do it already. I did it already, so I ain't going to do it again. I'm not going to do it again. And so these are some of the issues that we face right here in our society. It says probably the strongest predictor for sexual harassment in a workplace is whether there is widespread tolerance of this or for this kind of treatment. Companies that have strong anti-harassment policies in place provide the best protection for men and women. There are some companies that they have zero tolerance for sexual harassment. And if you ever try, there's no suspension coming your way, it's immediate termination. Immediate termination. So they provide the best protection for men and women who otherwise find they have no choice but to quit their jobs to escape harassment. And we have seen that. There's some persons who quit their jobs, men and women, because of sexual harassment. And they may not want to speak out for fear of what the public may say and what this person may say and jeopardize their whole life. And so you find that they just get up and they leave the workplace, they go and find another job, or sometimes they even leave the community, leave the area, or I dare say, leave the country. And it is something that, yes, it is really happening within our society. There are some persons that are being harassed to the point where they have to quit their jobs and they have to move on and move to another country to start all over again. I don't think we understand that's what's happening. We don't understand that. Now, it says, while there are federal and state protections in place, of course, this is referring to the United States. And, of course, down here, we currently have in place the Domestic Violence Act of 2014. They often involve pursuing a case through the courts. And many people simply don't have the resources to see this through. And so you may be sexually harassed or sexually abused, and you say, well, I'm going to put lawyer on you, and I'm going to go to the court, and all this. But in many instances, in many cases, victims, they don't have that financial support. They don't have that financial support to see the entire process go through. And so for people who can't afford to quit, staying silent may be seen as the only option. So you have those who can't afford to quit the job, so they can stay silent. And then you have those who quit the job, want to take legal action, but they can't because they can't afford it. And then, you have those who don't quit their job, but take legal action. We're going to take a short break. and we are going to return. The phone lines are open, and you can call us right here on Voices on 1FM 98.9 so that we could have a good and fruitful discussion.
It's official! Friday, December 18th and Saturday, December 19th are VAT days. But you can come today and get pre-approved credit for VAT Day. Save some of the hassle of this VAT Day and drop by some of your local Hosford's department stores today. Yes! Come to any Hosford's department today and get pre-approved credit for December 18th and December 19th. No down payment necessary. That's right, zero money down. And no payment until February 2021. That's right, no payment until February 2021. Come to Hosford's today, where we will be dropping major discount plus pre-approved credit when you shop now. How, you ask? Well, it's simple. All you have to do is visit any of the Hosford's departments, including furniture and appliances, Ashley Furniture Home Store, Building and Nevis Centers, and the Automotive Division. Make your VAT Day wish list, and we'll do the credit check. Come back on VAT Day and get all that you picked with your pre-approved credit and be on your way to a merrier Christmas. Whether it's new furniture, a new stove, or a brand new car, Hosford's is giving you pre-approved credit today. Be on your way to a merrier Christmas. Pre-approved credit today for VAT Days December 18th and December 19th at Hosford's. Visit stores for all details. Paint it, tile it, improve it. Your walls, paint it. Your floors, tile it. Your home, improve it. Huge savings at the Hosford's Building Center. Paint it, tile it, improve it. Sales event happening now. Yes. Come to Hosford's Building Center now and get savings of 25% off all paint and up to 75% off all tiles. Yes. Nothing's are gonna keep at Hosford's with up to 75% off piles of tiles in all styles and 25% off all paint. Come now and get a chance to win $500 shopping spree at Value Mart with the purchase of 5 gallons of paint or more. That's right. Buy 5 gallons or more of paint and you get a chance to win $500 in free groceries. Starting now until December 31st, 2020. It's your home. So paint it, tile it, improve it. At Hosford's Building and Nevis Centers year-end Paint It, Tile It, Improve It sale. Come now. Save big and simply paint it, tile it, and improve it. The event starts now and ends December 31st, 2020. Terms and conditions apply. See store for details.
Good afternoon, we are back. We have a call. Good afternoon, caller. You're on Voices.
Good afternoon, Devon.
Good afternoon. How are you?
Oh, you're giving God thanks, man.
Yes.
Yeah, like you, I was quite impressed with the youth parliament. I think they did a fairly good job.
Yes, they did, yes.
You know, they had their definitions and everything. And I wish sometimes that they elected and nominated members of parliament would be as clear as they were. There was a young lady who sounded like a new vision. So I was wondering if it was a combination of the St. Kitts and the Nevis Youth Parliament. Was it?
No, it was just it's Sniper, the St. Kitts National Youth Parliament
Oh,
Association.
one of them who spoke had this kind of childish voice. She sounded quite new vision to me.
Oh,
She was she was a member of the opposition.
Opposition. I think I know what you're talking about, but I don't think she's.
She has a kind of selfish voice.
Oh.
Yes, and today, as we know, or as it is celebrated, today begins 16 days of activism against all forms of sexual discrimination or gender-based violence. It is called gender-based. So it's not just women and girls, it is all genders. And you know what you were talking about in terms of sexual harassment. There's sexual harassment and there's sexual harassment on the job. Because they are actually two different things, eh? One is specific and one is general. The one they did today covers everything. It covers both on the job and off the job. Now, I recall I think it's just this year, this man Epstein. You remember Epstein incident? The one who hung himself in the prison in the USA.
Yeah, I think I heard about that, yes.
And they talk about this, they were recruiting the young ladies for himself and his high-class friends. And then there was the one who owned this old movie establishment. I think he's in prison still. And when the women filed the charges, people were saying, oh, what are going to just come with it and you know what they're going on with. But if you stop to analyze, even as you were talking about, some women are forced into some positions based on their social and the economic status. Not everybody can afford to walk away.
That's true.
Not everybody can afford to walk away, you know. Especially when there's no supportive framework in which to do so. Everybody know by now in the movie and the film business, if you want to progress, they demand sex. We have heard it time and time again, and we have heard people come out, even in the music business. The publishers and the whatever, those who do the marketing and whatever, sometimes your success or failure depends on your, I wouldn't say willingness, sex. In jobs promotion, many persons are asked to, well, if you want to move up, you have to have sex with me. Now, people may say that is transaction. That's not transaction, you know. When you have unequal power, there's no transaction. It's a matter of power. And it can be done in so many subtle ways. You don't want to comply, they give you the most onerous shift. Well, if you're not going to give me, then you work all the midnight shift. You know, that is sexual harassment, you know.
Yeah.
And they know you have children at home, so they make sure that they demand that you work overtime. Knowing fully well, pressuring you, you know, the Calypso Rose song, you're going to keep your dignity. I keep your money, and I keep my dignity. That is what we expect all women to do. And men too. Homosexuality, a lot of men have had people push themselves upon them. Sexual harassment. And then you walk away with scars, you know. But we as a people, we have got to learn to be more respectful of people's spaces, people's body, and to think that you wouldn't want anybody to do it to you. I mean, sometimes you hear shoo-shoo. Somebody comes in to fill a position, and they clap them over your head, you know. I recall when I was in the public service, more than once, I had to tell some people in prominent positions, do not call here and ask for any of my workers. I did not care if you were minister or minister. I was telling you. You want to talk to them after 4 o'clock.
Yes.
Because it is so blatant in government offices. Young women join the thing and being harassed, man. Everybody feel that they have a right.
But you know,
they have a right.
Yeah, there are some employers who feel that they have a right to sexually abuse their employees.
And sometimes they're so smart. You have a boyfriend. You know, they start the conversation. soften you up, as they say. I mean, it is time enough that our people learn to treat other people with respect.
Yeah, that is true.
With respect, kind lack of respect, why you would do somebody so? Whether male or female, lack of respect. So you have them at your mercy. What's that called? You see this corona? Man, I tell you, sexual abuse, sexual violence, and sexual harassment. You have desperate people out there. Desperate men and desperate women and desperate young people looking for an opportunity to be able to buy a bread. And what do they get? Sexual harassment. Someone, oh, you could come by this afternoon. You know what I mean? That kind of thing?
Yeah.
And if you stand up for your right, you're blacklisted, you know. You know you're blacklisted? You hear, oh, no matter with her, she rude, she out of order, she don't know her place.
They try their best to, bring you down and so on.
Huh?
They try their best to bring you down and then, you go
They
to look for
blacklist
another
you.
job.
It's like what they used to do on the sugar estates. If you work on an estate and you stood up to the manager for your own right, sometimes they short pay you deliberately. And you know how to do your numbers and maths. And you say, well, Mr. Henry, well, I work 5 days, how come? Oh, well, you're out of order, you're going to question me. So you're calling me a thief? And then, oh, well, don't come back Monday. Then they go and they call the next manager for the other estate and say, look, I'll fire Devon today. Don't hire him because he's not but a troublemaker. Blacklist you. You think all the young women who can't get work is because nobody want them? Some of them are unwilling to bend. And we have got to be a better people than that. And you see, what we need is for our leaders, church leaders, political leaders to speak up. Speak up in defense. Because today is the day, We have 16 during 16 days. These things are rampant in offices, rampant in the private sector and the public sector. Young women, young men, molested, abused. Oh, well, if you want a scholarship, scholarship, you got to lie down for scholarships too.
Right.
You got to lie down for scholarships. And some parents turn a blind eye to it too.
But some parents, they're a part of it.
Yes.
They support the whole thing. Oh boy.
Look, I recall maybe my sister listening, she might laugh. I recall when my sister left high school. My mother's friend, feeling sympathetic, says she went to girls' high school. Well, you could send my sister, I'm not going to call her name, down to see the Minister of Education then. One with a reputation for molestation of young ladies. And maybe the person was innocent, you understand? Because sometimes you could send her to Devon, see if Devon could get her a job. My sister said, she tell the woman, you could send your daughter. Send your daughter. And it happened again and again. You looking for a job for your child, and you can send them down by me, Send them to my office. Sometimes you better go with them. You better go to the meeting with some of them. You go to university and you bust up your brains and I went so I know what it is. And you come back looking for a job that you are qualified and capable of doing, and a vacancy is there that you can fill. Why should you have to pay with sex to get it? Sometimes we laugh at these things, but it's painful. It is painful. And so I want to encourage our people to change these things. It is not helping us. It is not helping us, whether a man or a young man. Some young men are stuck in jobs, stuck in a job and in a position. And you will say, well, Devon is such a good worker. Well, how come he still is the messenger? Just an example, Devon. And other people come after you and passing you. And you wonder what's going on. The boss may be a female who in love with one of them, because you have female molesters too. And it frustrates. You become unproductive and maybe drop out of work, drop out of life. So we should take this thing seriously. It affects your productivity. You wake up every morning, you have to go down to a job, whether in a store or shop, where you're being harassed. And in some shops, the customers openly harass the salespeople. If you work in a rum shop, well, I suppose all the rum drinkers think that you are easy prey. Or you work in a store. They come in to buy a piece of cloth. Oh, well, I like the cloth and I like you. And you hear these kind of things on the radio with some DJs. Sylvie and we say so. I mean, I just say, wait, people don't understand what they're saying. Do you understand what you're saying? So I hope we have 16 days to enlighten our people. And I'm calling upon those of us who are practicing it. You are hurting people. You have heard people say, well, some of them commit suicide. Some people are in positions today where it is a waste of their skills. They can't get to be what they want to be. And you, Mr. Man, or you, Miss, has contributed to it. All right, and Devon.
Thank you. Thank you, caller, for your input right here on Voices, 1FM 98.9. We are still taking your calls, and we are having this discussion about sexual harassment. Sexual harassment within the workplace, sexual harassment within the schools, church, everyday life. And we're talking about the fact that, there's some instances where a particular person have to perform these unfortunate practices or engage themselves in behaviors like these to keep their job or to be promoted or to receive some sort of opportunity, to receive a scholarship to further their studies, to receive monies to further their studies. Right here within our small community. But today is the day when the gender affairs officials will begin that day of 16 days of activism against sexual harassment. Sexual harassment among men, women, boys and girls. And it is not something that we should try to deem as, oh, this is nothing important, and we should not be talking about this. It is important. Because many of us, we know someone today, we may know someone today that is being sexually harassed. Or we know someone that was sexually harassed. Or we know a few persons who were sexually harassed. But it begs the question, what did we try to do about it? What did we do to try to help them? That is the question that we're asking. That is the question that we must ask ourselves. Because you're going to have some instances where people will speak about gender-based violence and sexual harassment, and they say, yes, let's fight it, and let's bring awareness and draw attention to it to let persons know that this is not right and this is not good and you should not sexually harass anyone. But what have you done? to bring awareness to the issue. But I have on my orange shirt today. I have on my orange shirt today, and my socks, they have a little bit of orange. So I'm playing my part, my role, rather, to bring awareness to the issue. Playing my role in bringing awareness to the issue and facilitating this program so that we can hear your concerns, your questions, your queries, your opinions about this topic of sexual harassment, sexual abuse. But we are still taking your calls right here on 1FM 98.9 for this Wednesday, November 25th edition of Voices. We are continuing this discussion for today, and we're just going to head back to the statistics that I was presenting earlier. Now, it says not surprisingly, sexual harassment, whether in the form of verbal or physical abuse. So you have verbal sexual harassment and physical sexual harassment, had a negative effect on job satisfaction and psychological well-being. Still being active, just before I continue, we'll take this call. Good afternoon, caller. You are on Voices.
Hello, good afternoon.
Good afternoon.
It's Latrina. I'm like I run in a little business. And you're in the motor here on the other side of the flip. And they come in with it. Here, a guy that just come. I said, I don't want to hear it. I didn't come for that. And he down to earth and and he like a joke to him. But it's not a joke, he just like upsetting me. The person who is saying it to. I don't want to hear that. And he go me on and on and on and on and on. And all them things should cut out with me. You come, you relax, you have a drink, and find other friend who will want to dialogue with that. Not really me. So sometimes I just say, I wish you could just don't come. But you will come, and but sometimes to him it's funny, but to me it's not no fun. I just say, oh my gosh. Oh my, how much I gotta be in this here. And so on. And at the workplace, I think now technology is so high, and you could see me at my desk and I could see at your desk. I think that they cut out with it. But as Mr. Sylvain said, we really had somebody like that at time around here for true. And it was, oh my gosh. Because at that time things were so down in the 70s and, not much money. And the person used to just do that to young girls. You go to work with them, they had to tell you this upset story. Some people take it and make you run away. I know one or two people who they mess with and they just run away from the matter. And we ain't going to get no right, as Mr. Sylvain said. We don't even know how to deal with it. If you say, well, I'm going to get a lawyer, put a lawyer to it, the lawyer going to call that the person, say, well, Miss So-and-so came here with this thing. Is it true or what you want me? What I must do. It's me or you're going to call the person. And, dialoguing. If you don't do that, it's me or you. Right? And that's when you look, you go, he just second him. Well, you don't want to make up the case with the person. No, I think not in the state. I like the state. You come and make a complaint. I didn't like what happened. And you dealt with it. So that, I noticed some of the women out there got this kind of thing in their head. Oh, that's lie. We were taking the man money all the time, and he want to relax with him, and she going, no. So like he had a case here with a movie star, Bill Crosby. And people saying, oh, it ain't. I find a big woman and say it ain't true. I say, yes, it's true. Many times I don't sit down to me ready, you go by a man, oh, you ain't going to fight, and you're trying to all over you. So you didn't come for that. You told me come by your pass by you. I saw them and the thing. Maybe they pretend it never happened to them, but it happening come. It just happened common to women. So I don't know if she was just neglecting him. And she was to have it to her. I say, yes, it's true. Oh, so much a man so long. Yes, it's true. It's true. Some men, you come at the place for a drink, they throw something in the drink before you reach, you don't even know what it was about. What it was. So, women, I don't know who they don't get. Anyhow, I hear a man really on to a woman and she didn't without consent, it was true. Because they got in mind for that, and you didn't win for that. And it happened right in thinking. There's a gentleman as a photographer, he is now. And he used to do ladies that. And one Sunday, the person wake up with find himself in this naked state, and he had to get up. He had to get prison for it. And a lot of nice up-to-date nurses and secretaries, ladies, and whoever used to go to him. So I don't know what happened to this young lady. I told her, nothing got done. She's sick. I told her, yes, I believe this thing does happen. Okay. You have a good day.
Thank you, caller, for your input and voices right here on FM 98.9. We are still taking your calls, and we are having this discussion about the sexual harassment among our women and among our men within the workplace, church, school, play, within our community. We are still taking your calls as we approach the 1:30 hour. If we have no calls, we are just going to acknowledge our sponsors one more time, and when we return, we will continue to take your calls.
It's official! Friday, December 18th and Saturday, December 19th are VAT days. But you can come today and get pre-approved credit for VAT Day. Save some of the hassle of this VAT Day and drop by some of your local Hosford department stores today. Yes! Come to any Hosford department today and get pre-approved credit for December 18th and December 19th. No down payment necessary. That's right, zero money down. And no payment until February 2021. That's right, no payment until February 2021. Come to Hosford's today, where we will be dropping major discount plus pre-approved credit when you shop now. How, you ask? Well, it's simple. All you have to do is visit any of the Hosford's departments, including furniture and appliances, Ashley Furniture Home Store, Building and Nevis Centers, and the Automotive Division. Make your VAT Day wish list, and we'll do the credit check. Come back on VAT Day and get all that you picked with your pre-approved credit and be on your way to a merrier Christmas. Whether it's new furniture, a new stove, or a brand new car, Hosford's is giving you pre-approved credit today. Be on your way to a merrier Christmas. Pre-approved credit today for VAT Days December 18th and December 19th at Hosford's. Visit stores for all details.
We have a call. Good afternoon, caller. You're on Voices.
Good afternoon, Mr. Cornelius.
Good afternoon, sir.
Unfortunately, just talking a problem to death do not result in a solution. 16 days of activism means that you should actually do something about it. Okay, but the question is what? Mrs. Henry rightly says that this abuse is essentially a result of unequal power, okay? The abuse of power in a situation where one is more powerful and the other isn't. And she even referred to some instances where power was abused, and practically the whole country knew of what she speaks, you know. Right? Even now, some occupy the corridors of power, but they and participate or have participated in the same kind of abuse that you speak about. But the society as a whole just tolerates it, right? You know, or maybe they just turn a blind eye to it. And that is why I suggested on Saturday on your program that we should just demonstrate zero tolerance to all abuse regardless of what form it takes, right? And the compartmentalization. You know, how can we live in a society where one form of abuse is sanctioned and the other is vilified? You know, that's inconsistent. It's hypocritical, and it's a double standard. Right? I didn't hear the debate this morning. You said it did. So I wondered what was your takeaway in terms of practical solutions to end this sort of abuse. What did they suggest as a practical way to move forward on this? Okay, because as I said, activism suggests that you actually don't just talk about it, but take concrete steps to end it. Okay, then.
Thank you, caller, for your input. And very interesting question. What I would say, we have had many cases around here of sexual harassment and sexual abuse. Doesn't matter what age or gender, and those cases are literally pushed under the rug, especially if the person is not, let me say, important. And so if these cases can be pushed, not under the rug, but if something can come out of these cases, I think that is where you begin with activism and speaking and doing something to bring awareness to the unfortunate social ill of gender-based violence. But we'll take this call. We lost that call. So, yes, bringing awareness to the issue, wearing the color, doing posters, doing other activities is fine. Nothing is wrong with that. But I understand where you're coming from, caller. We have persons right here within our community that they are still sexually harassing persons, vulnerable persons. There are cases that have been pushed under the rug. Well, you're not important and you're not important. And so we're not going to push that case. And so until I see the authorities punish these perpetrators, then I can definitely say something is being done, or some serious consideration towards gender-based violence. Again, the activities, bringing awareness to the issue is fine. And even as I'm here wearing my orange, bringing awareness to the issue, you know, it begs the question, does it really cause for so much awareness? Is it that people don't know that persons are being abused sexually or physically, whatever the case may be? I'm not saying that the activities are not important or insignificant, but people very well know that gender-based violence is a real thing right here in our community. But we'll take this call. Good afternoon, caller. You're on Voices.
Yes, no, in response to what the last caller said, it would require legal action. It has to be made a crime. You cannot, whatever is not a law, cannot be prosecuted. And that is why I agreed with one of the speakers this morning. We could talk about it, highlight it, unless and until it becomes a law with serious penalties. Not just to brush off and, oh, well, you get a reprimand. Or one of them was saying, you get counseling. They could give, the prison is a good place for counseling, You are able to sit down in the prison and reflect. They spoke about a registry. Now that is a bit tricky because you have the sex offenders registry. That is where they will have to go. Sex offender registry does not mean somebody who commits sex alone, you know. Sexual harassment is a sexual act. And that is where we should be moving towards. And while we have in the activism, we're supposed to be lobbying for that. It doesn't make any sense every year you go to the same thing. When it is sexual harassment, sexual abuse, domestic abuse, and then the penalties are questionable. Laws and recommendations go unheeded. You know, I read the sexual harassment on the job. In the workplace, it is called. It forms part of the labor code, the draft labor code that is being proposed. And it says, you know, when somebody comes on the job, the first day they show up, they should be given a booklet. Well, everything is now on the internet, on the computer. But maybe giving them a hard copy might be good too. That outlines what is sexual harassment on the workplace. You don't wait until they do it to tell them it is. So that when you turn up by my business place, good morning, Devon, and I'm glad to have you. And these are the workplace rules. And in it, you have the sexual harassment and the means of addressing it, so that in case it happens to the worker knows the avenues to which it has to go to get redress. How many? I don't know if the foreign-owned business places do it. The hotels, I don't know, because in the hotels it could be rampant in there. Some guests actually come with the notion that the workers are prostitutes. So you go into the room to make up the bed and they want something. There have got to be avenues, rules laid down for both guests. You see what happened to the man in Anguilla? I mean, that gone for naught, you know. Time and time again, sexual harassment. So I am saying businesses you don't have to wait until the law passes. You can have the samples in the book, in the draft labor code, where companies prepare these things. You may have, for example, in these factories, we have hundreds of women, and one or two are some male superior employees. Sometimes those things rampant in there. Sometimes women, they don't know their rights. You may go down to the labor department and complain it. They may call them and warn them, but you have nothing to back it up, so they ignore you and they pick the next victim. You go to the police station, what are you going to get? The other day, they were circulating some anonymous thing that was claiming that it was happening in there, but I wouldn't be surprised. Wherever you have both sex, male and female, it is likely to happen. You have cases where officers are promoted over other officers without having written one exam. According to the rule, you're supposed to write the exam and pass it to be promoted. People pass you, get all kind of who not superintendent, is corporal, is inspector, is ACP. You know what I mean? Climbing up the ladder. And and to me, the higher your rank, the stronger should be the punishment. We can't continue like this. Whether it is in the police force, well, in the army is worse. I mean, there have been cases in the U.S. You might, if you search, you will see. We have female soldiers who are being harassed and abused, raped and everything in there. With the knowledge, they're going to make complaint. Nothing. Some of them go insane. And if our men who are listening knew or understood the effect it has on the emotional state of the victim, you might think twice. You know, you can't walk up Port Street in Bastia without being sexually harassed. You can't walk in Bastia, you know. I don't know about Nevis. But Bastia, where the men love to hang out, on every corner, every street. Female passing, we have had at the Association of Disabled People, right? Disabled people, you know. Disabled, differently able, as we say. I mean, the females are being harassed, sexually harassed. Sexually harassed. Some of them are in danger of, if they walk certain place, they are likely to be molested, raped even. They go on the buses, sexually harassed. And busmen, if you're listening, let me say, because a lot of you are guilty of it. Sexually harass the female passengers. And we take it as the norm. But it is time enough that something be done. I am glad the young people took the opportunity to discuss the bill.
Yes.
And I hope it goes beyond the discussion. It makes no sense just talking, and every minute then you hear a woman kill a man. And what you say, oh, she's wicked.
Yes. Well, thank you.
You don't want to push it to it.
Thank you so much, caller, Miss Henry,
All right, then.
for your input. And we're going to end this segment of Voices right here on 1FM. Thank you guys so much for tuning in, and thank you guys so much for being a part of this very meaningful discussion. And definitely we will continue to have these discussion. Thank you guys once more, and continue to have a wonderful afternoon, and continue to give thanks for life and be grateful for the opportunities that you have. Have a good afternoon, everyone. Bye.